वेक्टर-बॉर्न डिजीजेस जैसे डेंगू, मलेरिया, चिकनगुनिया और टाइफाइड से हाई फीवर होता है। इस दौरान कम फ्लूइड कंजम्पशन और इलेक्ट्रोलाइट लॉस की वजह से पेशेंट की बॉडी डिहाइड्रेटेड रहती है। अगर इस दौरान पेशेंट अच्छे से हाइड्रेटेड रहे तो वो जल्दी रिकवर हो सकता है।
मम्मा, मैंने बोला था ना।
हाँ जी मिसेस शर्मा, शुरू करें।
हेलो हाय, हेलो हेलो हाय। सारा दिन फोन पे रहती है ये कमला। गिरा 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 मेरा गमला।
मैंने बोला था ना।
हर बात की कहानी आज बरसेगा पानी। ओ पिंकी के पापा प्लीज प्लीज टेक द छाता।
प्लीज टेक द छाता भाई साहब, प्लीज टेक द छाता।
मैंने बोला था ना।
लाल पीला हरा नीला साथ में धुलाएगी, व्हाइट कपड़ों पे क्या रेनबो बनाएगी।
मैंने बोला था ना।
पिंकी बेटा लेसेस, डोंट मेक दोस फेसेस। याद आएगी माँ जब गिरोगी।
मैंने बोला था ना।
बिजली की है तार, भैया बनो नहीं स्टार। हाँ यस नो नहीं।
मैंने बोला था ना।
सबको दिया ज्ञान पर खुद का नो ध्यान। हुआ फीवर थकान, अरे अब तो जाओ मान।
मम्मा, एनाज़ाल।
पी लो। वेक्टर-बॉर्न डिजीजेस जैसे डेंगू, मलेरिया, चिकनगुनिया और टाइफाइड से हाई फीवर होता है। इस दौरान कम फ्लूइड कंजम्पशन और इलेक्ट्रोलाइट लॉस की वजह से पेशेंट की बॉडी डिहाइड्रेटेड रहती है। अगर इस दौरान पेशेंट अच्छे से हाइड्रेटेड रहे तो वो जल्दी रिकवर हो सकता है।
मम्मा, मैंने बोला था ना।
Good morning. Diabetes mellitus, very common illness, and I am sure an average good GP must be having at least 2 to 3 cases of diabetes in his clinic every day, at least. Now, that does not mean that I am trying to say that he diagnoses diabetes in the clinic. No, please don't misunderstand. I am saying patients have come for many complaints or any other complaint, but they were diabetics. That was a comorbidity. If you had asked them, he would tell you. Sometimes the patient also forgets that he is a diabetic, and the doctor also forgets that he is a diabetic. So, I am going to show you 3 patients where I will show you that in diabetes there is something special in diabetes patient. When they come for this so and so symptoms, which I am going to show you. We'll start with the first case.
Qureshi, मैं तो कुरैशी बोलता हूँ. He's Dr. Qureshi. He's a bone setter. Bone setters are good doctors than orthopedic surgeons. This Qureshi, I call him Qureshi. His name is big name. My Qureshi are my old, the बाप दादा के ज़माने से खानदान of Qureshi. They used to come to me. आजकल कमती आते हैं, इनको मेरी फी 20,000 रुपए है ना. Naturally, they come only when required. But he is a bone setter. No, I want to show him. Just see his pulse rate. Count his pulse rate. He is a diabetic, severe diabetic. So insulin, this, that, आप वो डायरी लेके आए हो शुगर की? वो जो छोटी डायरी लाया? नहीं लाया है उधर? हाँ दिखाओ छोटी डायरी. How much?
It's around 90. I've not counted. It's around 90.
More than 90, yeah? Right. His pulse rate is still about 95, 98, tachycardia. That day I told you last week. Last week. Patient comes with loss of weight, rapid. Tachycardia, finish. Whether he has got thyroid here or not, forget it. He got thyrotoxicosis, hyperthyroidism.
Right.
Oh, blood sugars are very good. Severe diabetes. No, that is not a problem. I don't want to show. He developed diarrhea. And what diarrhea? रात को कितनी बार जाना पड़ता था अंदाज? 7-8 टाइम रात को.
रात में 7-8 बार करीब.
7-8 टाइम रात को. Irritable bowel syndrome, never will they go at night. No. Starts early morning. First, second, third, fourth. Night diarrhea means disease. Tuberculous abdomen, malignancy, myelofibrin syndrome, strongyloides, etc., etc. That's not the point. Point what I want to show you is this. That out of every 100 diabetics, and now you will have thousands of diabetics in your practice, 1% patient will develop what he developed. 1%. But then they're admitted, hospital, colonoscopy. Wrong. Last week what did I tell you? If anybody comes to you from a gastroenterologist, colonoscopy normal diarrhea, cortisone level, hyperthyroidism, but then they are semi-solid. Today I am showing you another patient. Diabetic. Every diabetic has got peripheral neuropathy. Every diabetic. Last time I showed you that Hathiyar tuning fork. Every diabetic patient. He hasn't got tuning fork. Aap nahi sun sake. When I put that machine there, zoom vibration. Every diabetic has got peripheral neuropathy. But some diabetics develop autonomic nervous system neuropathy. Sex weakness is common in all. We forget about sex weakness. His problem was when he used to stand up. वो चक्कर जो आते थे क्या होता? खड़ा होता तो चक्कर आ जाती थी. खत्म. खड़े हुए तो खत्म. Moment he stands up,
5 सेकंड भी खड़ा नहीं हो सकता था.
इसके अंदर
5 सेकंड खड़ा रहना भी मुश्किल था मेरा.
5 सेकंड खड़ा होना मुश्किल होता था. 5 सेकंड खड़ा होना मुश्किल होता था. My secretary, I told her outside, see his pressure, sitting and standing. Sitting and standing difference was 130 millimeter difference. Pressure 150, the moment he stands up 120. 1 second. And the pulse, tachycardia. For that again they did a heart test for him. Why tachycardia? Why? His heart is weak, this is weak. Why his pulse is fast? Thyroid test? No. This is autonomic nervous tachycardia. Today he is a little better, much better. He had lost so much weight, then he put on 3.5 kilo weight. And I told him to go and start working. Bone surgery, काम पे जाते हो ना?
अभी जाता हूँ.
अच्छा है, सोशल काम करते हो, दुआ मिलेगी. घर पे बैठ के चक्कर आते नहीं आते. So we treat his postural hypertension, we treat his diabetes and his diarrhea with, I told you last time, severe diarrhea with no organic disease, autonomic, codeine. I think I'm very tired now and we'll have 10 minutes interval. Give him a big hand. The big hand. He was not wanting to come. कुरैशी बहुत भला है.
आपने बताया नहीं, मैं भी गाड़ी चला रहा हूँ.
हाँ गाड़ी चलाते हैं. He is driving the car also.
4-5 घंटा गाड़ी चलाता हूँ कंटिन्यू अभी.
Continuously. Because I'll tell you treatment of postural hypertension. If you control pressure falling down, you can do everything. Thank you. बहुत बहुत शुक्रिया.
Thank you.
We'll have, no.
The symptoms of autonomic nervous neuropathy. The diarrhea, although I told you last time codeine preparations are very good, but codeine is not available in the market. Opium preparations are not available. So Imodium is a very, very good drug for diarrhea. If you give him one tablet of Imodium at bedtime, most probably he will not get up for his stool. Similarly, postural hypertension is treated by usual method. The cuff bands, proper stockings. I also gave him fluoric cortisone to control the postural fall of blood pressure. And the tachycardia, when he came, it was 120, settled down. Now, when a doctor with diabetes sees 120, he will think it is heart, definitely heart. So, if the cardiogram shows slight changes, he will blame the heart. It is not the heart. It is autonomic nervous system. It is causing tachycardia. And if you treat him, he will come down. So, in a diabetic patient, you remember to diagnose this in a patient having those symptoms of night diarrhea and postural giddiness. Two symptoms. Very, very important. Right. Next, please.
Akbar. Good morning.
Good morning, sir.
What a tall, healthy young man. But the only his bad luck is that he's a diabetic. He's a diabetic. So, take out the shoes and raise your pant. Here, come on, quick, fast. And so he works with a doctor. He has got some medical knowledge. So in diabetes, he knows that if you get swelling of the feet, bad sign. Could be heart, it could be kidneys. So when he got swelling of the feet, he came to me the other day. Have I got heart or kidney? No problem. Ask the urine albumin, absent. Urine albumin absent means there is no diabetic nephropathy. Cardiogram normal. So it can't be heart edema, no veins here. That means the commonest cause is venous hypertension. So I made him remove the pant. And now you see, what beautiful. See, and he's standing now. Now look at the, give me this. And look at his prominent veins when he stands for 1 minute. These are not varicose veins. This is venous hypertension. Don't mix up that here. See this. Veins here, veins there. You are seeing there. See this vein. See this vein. Big vein. Look at this here. 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 Thoda turn aisa karo. Yeah. See this patch of vein. See this vein. Turn like that. And let me see your Akbar. I want to show that ankle. See, it's getting pigmented. No. Turn it. It is. See the color there. See this. Turn it. See, turn it. Look at the pigmentation starting. Look at this pigmentation. And turn it again. Look at this is not normal. His normal skin is a very fair, handsome fellow. He is becoming black there. Turn back. See this patch here. See the veins descending. See this. Beautiful. Akbar, thank you very much for teaching them. Huh? You taught them. Give them a big hand. Venous hypertension, same treatment. Sleep at night, leg raised, buy stockings, tight stockings, wear all day. Sit with the leg raised.
But an average doctor and cardiologist will, you should have time to remove the clothes. Please remember that unless you remove the pant and the clothes, you can't elicit the physical signs. The second thing is, he should be in standing position, not lying down. And that too for about 2-3 minutes. And then the third thing is that you examine these patients, the legs properly, ankles, look for the pigmentation of venous hypertension. So I was telling you, the average doctor, they have no time for all this. So they will just say, albumin absent, so cardiac. So ECG shows some non-specific changes, TV changes. Or some mild abnormality in 2D echo. They say this is due to heart. And put him on a diuretic. This is how these patients are missed. So I want to tell you that although he may be a diabetic, please spend time in general examination in looking for the commonest cause of swelling on the feet. We'll have the next patient now, third patient.
Now, Haji Manohar. Haji, इधर आओ. अस्सलाम वालेकुम. अरे क्या हाजी मियाँ तुमने यार पिछले संडे हमारा नाक काट के ये लोग बेचारे आए थे तुम्हारी इंतजार की और पानी भर गया था बोलता है लास्ट संडे वाज बिग रेन. I want to tell you one thing. हिस्ट्री which he gave me. पहले टाइम जब वो गोश्त खाया था, बड़ा गोश्त, और इधर जोर का दुखा था उल्टी, कितना दिन हो गया उसको?
17 जून को हुआ.
नहीं पहले टाइम
तो 3-4 साल.
इसके अंदर बोलो.
3-4 साल पहले.
4 साल पहले, 4 years back, एक दो big, he says, due to big meat which he ate, severe epigastric pain, vomiting, पसीना, उल्टी, ये टाइम 15 जून को हुआ. 17 को फिर वही बड़ा गोश्त खाया था.
नहीं,
छोटा गोश्त के बाद again he is blaming mutton. No food can cause severe epigastric pain. I'll give you in writing. I'm talking about severe epigastric pain. I'm not saying burning. Severe epigastric pain, vomiting, sweating. Gallstones are on the right side. And the differential diagnosis in the past, I used to give a pain here due to amoebic abscess, gallstones, etc. And then I have been writing, I changed my mind. Gallstone pain is in the epigastrium, not here, or the gallbladder. Remember that. And it is unfortunate that the heart pain has been taught here. Heart pain is here, is sweating, vomiting. Dyspnea, no. Epigastrium also. If severe epigastric pain comes with sweating in this heart infarction, infeval infarction, differential diagnosis. First you should do ECG. Because biliary colic is not such an emergency. Heart is a serious emergency. Within 1 hour you have to start. And the third cause is pancreatitis. Pancreatitis. In general practice, although I don't teach pancreas anymore, the students have gone. But you don't have to learn pancreatitis. All daru wala people who do drink daru, if any day they develop a severe pain in the epigastrium, vomiting like this, alcoholic pancreatitis. Spot diagnosis. Number 2, all patients who have got gallstones, the sand can enter the pancreas. So many of them, that epigastric pain which is there is possibly also again due to pancreatitis. Sand has entered, How will you come to know? Not by imaging, blood test, amylase. Third thing I have brought him here. डायबिटीज का तुमने शुरू किया कि मशीन लाया किधर है मशीन इधर लाओ शो द मशीन सो माय एज ए आई एम आल्सो लाइक ए जीपी आई एम ए हाई क्लास जीपी सो व्हेन आई डायग्नोज डायबिटीज आई डोंट सेंड हिम टू डायबिटोलॉजिस्ट व्हाई शुड आई सेंड हिम बट ऑल आई एम डूइंग इज he has been given a glucometer he is taught how to do blood sugar and see how he maintains his blood sugar. He is keeping the record 152, 133. Here is a machine. He has learned it. And he was hesitating to learn. When he was hesitating to learn, I removed his mobile. I said, my mobile lag dunga tumhara. How did you learn mobile? Learn it. Because lifetime you have to do it. That is the problem. Lifetime. Lifetime is what? He is already 60 plus. How do you know he will live 10 years, 20 years? And the important method of this learning is not diabetes. After the age of 60, these patients develop low sugar at night time in the same dose. And they will have palpitation, sweating. The doctors come, heart, blood pressure, all wrong diagnosis. It's a low sugar. So he has been told, if any day you have any symptoms of sweating, ghabrat, palpitation, certain, take this, do sugar. If it is 60, 70, it's an attack of low sugar. Sugar khao, khatam, finish. This is what he has to learn. Keep your diary, keep weekly blood sugar ready. Finally, I've called him, he's come to udhar to tum ekdam bada minister lagte ho yaar UP ke. I called him. If you get a patient at this age, diabetes, and gallstones, of course, he has got, and amylase, pancreatitis, which will be due to gallbladder. Remember that both this combination can be due to cancer of the pancreas. Cancer of the pancreas, pancreatitis pain, diabetes, combination. Every year, last year I didn't get, but before that, every year, on an average 2 patients. Elderly man, diabetes, pain, pancreatitis, I get a sonography done, simple sonography, pancreatic tumor, turns out to be malignancy. Diabetologists will not do this, I am telling you. You do it. You send the patient. Because diabetologists are busy. 30, 40 patients, same blood sugar. Oh, that is common. Pancreatitis is common. It is a combination which will remind you at this age. Rule out a cancer. बहुत बहुत शुक्रिया. Give me a big hand. Yes, cream and all that. बहुत बहुत शुक्रिया. चलो.
Though most of the books do mention, the writers write on that pain, severe pain in the epigastrium with vomiting, sweating, differential diagnosis, gallstones, number 2, myocardial infarction. No books mention of when to test what. You see, these books have been written by full-time professors. They have never done private practice. Now in a private practice, if I get a patient, and I think this man, for example, he could be having a heart attack. He is a perfect fellow to get a heart attack. So moment he gets epigastric pain, vomiting, I want immediate ECG. Because the treatment of myocardial infarction starts immediate. In the first 1 hour, there are 5% chances they are going to die. In the next 24 hours, 10% chances they are going to die. We are in a hurry to send them to an intensive care unit, where if they develop an arrhythmia, they give a shock and the patient doesn't die. So, for me to get an ECG done in this patient is an emergency for me. Sonography is not emergency. If I want a sonography to see gallstones, I have to search who is a sonographer in my locality. Will he give appointment? Will he go? When will he go? When he will bring the report? It is not urgent. He will say yes, there are gallstones. Then I will tell him that get a oral surgery done by a local abdominal, get the gallstones out. But there is no urgency. The urgency is for you to learn that if you get such type of patient, first get a cardiogram done, then talk. Okay, next.
विनोद जी, थैंक यू फॉर कमिंग. आइए इधर आइए. पहले तो हमको आपको शक्ल उधर देखने दीजिए. अरे ग्लो करो जरा, देखें तो सही कैसी पर्सनैलिटी है. विनोद इज ए बिग पर्सनैलिटी, इज ए बिग ज्वेलर. एंड आपकी उम्र कितनी? 48 years. And plus he does a lot of social work. Jain, no? All Jain people, a lot of social work they're doing. He's a very busy man. I have called him to talk to you here in Hindi, not English. I want him to tell you that for what complaints he used to go to doctor. And what he had a lot of, he had also tamasha and all that. He used to go to eye specialist in the beginning, isn't it? Because everybody thinks eye problem is go to eye surgeons. Those eye surgeons know nothing about medicine. Zero. They've forgotten whole medicine. They only know about eye. That is the unfortunate thing today of every specialty. That's the trouble. Next Sunday I'm going to talk. Even today we are going to start after the interval. I'll tell you how lung and heart. Today you see, I'll show you how heart specialists, they know nothing about the lungs at all. And the patients are suffering. They're putting stents, patient is not improving. That's because he has got lung disease also. Last 2-3 times I told you, if you want to be a good doctor, comorbidity. Your strength lies in comorbidity. That if a patient is now, if he is 48 years old, okay, I'm 87 years old, okay, but he is not 20 years old. He is 48 years old, which is near 50, no? Sorry, his wife, very smart. But 50 is more than 20, more than 30. It's like motor car, exactly motor car. That you got a 2 years old motor car, but the same car after 12 years, same motor car. I'm the mechanic. How many? He will come with one problem, but I know the car. I have seen it. There got multiple problems. I know that one was done, this was done, this was done. So if I know those problems, so like this, if you also know lung, you can help the heart patient. But this is not your heart, this is your lung. The specialist does not think like this. That's the unfortunate part. Why? Because the specialist will think of rare thing of a heart. See, he thinks like that. Because he is only heart specialist. So super specialty has produced today the atmosphere where the general practitioners, family doctors, once more you are in the picture to help the patient. You can help the patient. He used to have some eye symptoms. He used to go to eye surgeons and all that. विनोद जी, आप बताइए आपको क्या तकलीफ क्या होती थी?
2008 में जनवरी में मुझे आइस का प्रॉब्लम हुआ था.
क्या?
थोड़ा सा आइस के पर्दा नीचे गिर गया था.
क्या?
आइस का जो पर्दा होता है वो नीचे गिर गया था.
पर्दा मतलब? नहीं, पर्दा का मतलब रेटाइना पीछे होता है. रेटाइना गिर गया तो खत्म, ब्लाइंड. तो आप पर्दा नहीं बोल रहे आप. ही वांट्स टू से द लिड. सी इन हिंदी देयर इज नो गुड वर्ड फॉर द लिड, अपर लिड. सो ही वांट्स टू से दैट हिज अपर लिड यूज्ड टू फॉल डाउन. You understood what I am saying? So last Sunday we saw the pictures, you know, the lid falling down. That was so he used to have that complaint. Lid used to fall down. For which he started going to eye surgeon. हाँ जी.
2008 में हमने बहुत से आइस के डॉक्टर को बताया था. तो 4-5 आइस के डॉक्टर को बताने के बाद एक डॉक्टर ने बताया कि हो सकता है कि आपको और कोई बीमारी हो. तो उसने उसका भी टेस्ट किया. लेकिन जब वो पॉजिटिव रिपोर्ट आई, उसमें कोई नेगेटिव रिपोर्ट नहीं आई, तो उसने भी बोला कि नहीं, आपको क्या प्रॉब्लम पता नहीं चल रहा है. फिर हमने और बहुत सारे डॉक्टर को बताने के बाद पता चला कि हो सकता है कि आपको माइस्थीनिया ग्रेविस हो. तो फिर भी उसकी रिपोर्ट नहीं आने के बाद भी उसके ऊपर दवाई चालू की गई।
That is because his antibodies, acetylcholine receptor antibodies were negative, anti-skeletal antibodies negative, EMG initially was negative. I told you last Sunday we discussed that unless you do a single fiber EMG, your EMG report can go wrong. Later on when it was done, दूसरी बार EMG किधर की थी जब positive निकली?
हाँ, दूसरी बार भी बॉम्बे हॉस्पिटल में।
That one. When that was done, that was positive. That was positive. So now, तो अभी आपको since then आपको steroids पे डाल दिया?
हाँ, तभी से मुझे 2008 से स्टेरॉइड्स पे वाइजोलोन ले रहा हूँ मैं, तभी से 2008 से 50 mg स्टार्ट किया था मुझे। धीरे धीरे मैंने भी योगा और वॉक करते करते उसको मैं 2-3 साल में 5 mg तक लेके आ गया था। लेकिन 5 mg आने के बाद वापस वही आइस का प्रॉब्लम डबल दिखना चालू हो जाता है। डबल दिखना चालू हो जाता है। स्टार्ट में फर्स्ट डबल दिखता है और 2-3 दिन में जैसे डबल दिखना चालू होता है और फिर अगर स्टेरॉइड नहीं बढ़ाया, मतलब कि गोली मेडिसिन नहीं बढ़ाया तो फिर वापस आईलेड नीचे हो जाता है।
आईलेड का हिंदी में कोई वर्ड नहीं है।
आईलेड जो नीचे हो जाता है उससे वो प्रॉब्लम ये होता है कि फिर थोड़ा तो सिर भी हैवी हो जाता है, क्योंकि वो अपन सोचते हैं कि आइस खुल जाए, लेकिन फिर वो वापस दवा बढ़ा दी जाती है और वापस 50 mg कर दी जाती है और ऐसे करते करते हर 2 साल में ये प्रॉब्लम होता है। तो अभी मैं 10 साल से तो ले रहा हूँ वाइजोलोन, लेकिन 50 mg से 5 mg आती है और 5 mg के बाद वापस वही प्रॉब्लम हो जाता है।
So that means he maintenance dose mind you 10 years he is taking, and I am telling you for 10 years. See again a steroid to give. Public is afraid of steroid. That is because doctors have been using it wrongly. Doctors don't want to know the side effects. Every good drug, if you can master it, how to give it. Easily when driving a car, more or less same.
मुझे बताया गया था कि आपको 1 या 2-3 महीने में डायबिटीज या ब्लड प्रेशर दोनों हो सकता है।
हाँ,
लेकिन
1-2 महीने में
मैंने हर महीने रिपोर्ट निकाली है, लेकिन आज 10 साल में मुझे न डायबिटीज है न ब्लड प्रेशर है। हर महीने में रिपोर्ट जरूर निकालता हूँ।
So 10 years he has used maintenance dose. See हमने
वाइजोलोन से थोड़ा ये इफेक्ट आया है कि मेरे दोनों में कैटरेक्ट हो गया।
हाँ,
कैटरेक्ट हो गया दोनों आईज में।
They say it can increase cataract, but मैं बहुत जैन पेशेंट हमारे बहुत हैं, मैं सच बोल रहा हूँ, वो कॉर्टिजोन नहीं ले रहे, सब 50 की उम्र में कैटरेक्ट का ऑपरेशन कर रहे हैं।
हाँ ठीक है।
So I am telling you, I have got जैन पेशेंट, I get surprised at the age of 40-50 cataract operation, 40-50 knee replacement भी आप में बहुत कॉमन है in Jain community. So but to blame steroids for that, I am not very sure. I am telling you that. So all I am saying is for 10 years he has taken steroid. He has no diabetes, no hypertension, no osteoporosis. I got his bone DEXA studies on bone densimetry. वो रिपोर्ट मैंने कल देखी, ब्यूटीफुल रिपोर्ट। बोन डेंसोमेट्री इज एब्सोल्युटली नॉर्मल।
डेली योगा जरूर करता हूँ, हफ्ते में 5 दिन।
वो दैट इज डिफरेंट। योगा तो अब नॉर्मल आदमी भी कर सकते हैं ना, नॉर्मल आदमी भी करेंगे, उसको आप वो नहीं बोल सकते कि योगा करने से कॉर्टिजोन के साइड इफेक्ट्स नहीं हो रहे, वो गलत है। योगा इज वेरी गुड, एवरीबडी शुड डू योगा, आई एम नॉट सेइंग दैट। ऑल आई एम सेइंग इज that last year I brought out a special issue of Bombay Hospital Journal, because I am the editor of Bombay Hospital Journal. I brought it for doctors to show that low dose steroid therapy, how safe it is. There are conditions where you have to give for 10 years, 20 years, lifetime steroid. Suppose kidney transplant you have done and your kidney is functioning, you might have to take steroid lifetime till you live for that kidney to function. So you can give lifetime steroid, nothing wrong in that. But it is how you tackle the side effects. Or his face, for example. If you see the face जरा अच्छी तरह दिखाओ, खाली face दिखाना इनका, हाँ, खाली face दिखाओ, नहीं आप इधर सामने देखें, हाँ, you know, see, it is, some normal people will be having like this. All is a little fullness here with the steroids, which could be passed on as a normal. This tummy is coming out. My tummy is not coming out.
इसके बाद ही आया।
No, but the point is that this tummy is so common in these people who are jewelers, who are पैसा वाला and all that. tummy हमारे people like tummy, हमारा tummy तो अंदर जाता है।
वाइजोलोन लेने के बाद ही आया।
Anyhow, what I am saying is some side effects are possible, but in his case, I've got his antibody का report कल नहीं आई थी मेरे पास पर. His antibody report has not come. Tomorrow, as soon as I go, you ring up. That if his antibodies appear, that acetylcholine receptor antibodies or anti-skeletal antibodies, although he has no thymus, his thymus is normal. They have done the studies. I will send him for removal of the thymus because we have New England Journal of Medicine, which is our Gita of medicine from Boston. It comes. They have shown number of patients of myasthenia gravis with normal thymus. When they removed the thymus, the whole disease pattern became less. Didn't disappear, became less. And it's a simple operation. So I am going to advise, if I find antibody, but suppose I don't find antibodies, then I will have no courage to say that you get your thymus removed. Because removal of the thymus, any surgery done on him, anesthesia has to be perfect. Anesthesia will be very difficult. आपको भी 10 साल में कोई हॉस्पिटल में भर्ती नहीं किया, दमा ही इज ऑल्सो एस्थमेटिक. एस्थमा के लिए भर्ती किया था? नहीं. बट बिकॉज ही इज टेकिंग स्टेरॉइड्स ही इज कंट्रोल्ड. बट सपोज दे गेट निमोनिया. अच्छा, आपने वैक्सीन लिया हुआ है ना? एक बार निमोनिया की वैक्सीन है. दैट आई मस्ट गिव हिम फुल वैक्सीनेशन and every year also you must take, because if he develops pneumonia, I have a patient, for example, myasthenia gravis. That day, this fellow, Marwadi fellow, he developed pneumonia. Moment he developed pneumonia, he had respiratory failure. The muscles were not working because of myasthenia gravis. He had to be put in the respirator. 3 days he was in the respirator, came out of it. But he had not taken vaccine. I told him, said, these people must take 2 doses of pneumonia vaccine. They must take a yearly vaccine, influenza virus vaccine, because any complication like that can land up in trouble, and then you will be in the ICU for no reason at all. Give me a big hand for coming. His wife also. Thank you, sir. Thank you. Thank you.
Myasthenia gravis is a very rare disease. I don't think you may not see one patient per year, but you may see one patient per year. But why I have showed you this patient is for the fact that the diagnosis is very easy, that any of the eye muscles in the evening, in the morning they are normal, afternoon they are normal, evening they get paralyzed. It is myasthenia gravis. It is so simple. In fact, in the evening, even or suppose your swallowing muscles give you trouble, but in the morning and afternoon they are normal. Think of myasthenia gravis. You will be surprised that I have been lecturing this for years and years, and every year or two, usually every year, I get a telephone call from an unknown GP who is attending my lecture, just to tell me he is excited. Sir, I diagnosed myasthenia gravis. See, it's an excitement that you can diagnose when all the 6 consultants could not diagnose. So it is worth knowing this illness. And next, we are going to show you 2 patients of asthma. And I am going to show you that how same asthma in a young patient is such a benign thing, and you just only talk and talk, while in an elderly person, the same asthma could be due to COPD and very serious. So, let us have the first patient. Ankit Jain, young man. Ankit. Oh, wow, यार तुम तो सचमुच हीरो बन गया है. Give me a big hand. ये तो तुम तो हीरो बन गए. You came for acting here? Huh? So moment I told him, so he said, I am going to wear full suit and this and that, and then इसका जरा दिखाओ उधर से. How does it? What? Please look. All these heroes nowadays they are putting this same beard.
South hero.
Huh?
Bollywood hero is South hero.
South hero.
Yeah.
Ankit. He didn't bring his file. Forget it. He's a Jain community, and these people are very lucky.
He's young, he's hardly 28. And big business, lot of money. So they always get married. You got married at what age? 1.5 years. 1.5 years back. So at 26 and all he was married. He get married, settled down. God has given everything. Business, wife, joint family, very good father, family, very nice. But God will always give you something, otherwise you will not remember God. That is the trouble. If He gives you everything, you will forget praying. Because you get something, so you pray, God, Hare Bhagwan, ye kyu, Hare Bhagwan mera ye, Bhagwan mera ye, like that. So this poor fellow had asthma from the childhood. Now asthma in the family, who else has got? Grandfather. His grandfather was asthmatic. And somebody else?
मेरी बुआ को भी है.
Buwa. That means father's sister. She is also asthmatic. So asthma, we are going to discuss after 2 weeks. Next week is neurology, nervous system. After that, second week is respiratory system. So respiratory system, we are going to talk about asthma. And all this asthma business is diagnosis. It's 1 second diagnosis, like amoebic abscess. 1 second diagnosis. His grandfather was asthmatic. His auntie was asthmatic. Since childhood, he gets attacks of breathing, asthma, wheezing. जब सांस होता है, उस टाइम पे खांसी भी आती है.
थोड़ा बहुत आता है.
खांसी आती है नहीं आती?
थोड़ा बहुत, ऐसा रेगुलर नहीं आता है. अभी कुछ भी प्रॉब्लम नहीं. अभी थोड़ा
पहले की बात करो.
हाँ, पहले ऐसे नॉर्मल आती थी, पर बाकी इतना जैसे
नॉर्मल खांसी आती थी.
हाँ, नॉर्मल जो खांसी आती है.
नॉर्मल खांसी आती. Many people use such words, you know. That way, वो खांसी नॉर्मल आती थी. That means normal person is supposed to cough. You people are all abnormal. ये सब बीमार हैं, उनको खांसी नहीं करते. So, asthma has got a associated symptom. This is called as associated symptom. In medicine we call like that. And that is cough. Asthma, cough go together. Some people have more asthma, less cough. Some people have more cough and less asthma. That is there you get caught. And people who think that cough is normal, like he used the word normal cough, they are the ones who will be completely missed. Diagnosis will be missed. You will never diagnose. Because they don't even come to doctor for complaining. They don't think it's abnormal. So, whenever he used to get this तकलीफ तो मुझे अभी होती थी ना, पहले की बात कर रहा हूँ. वो टाइम पे ऑल दी रात को ऐसी आवाज आती थी. उसको क्या बोलते हो हिंदी में, क्या बोलते हो?
सांस थोड़ा.
ये आवाज को क्या बोलते हो? व्हीजिंग, विस्लिंग, सीटी की साउंड. सीटी की साउंड. So wheezing, CT की sound. So wheezing is there. Is again very diagnostic of asthma. Then the symptoms more at night. This is an early night and early morning. See, rheumatology, I showed you this, how 1 second you could diagnose. Only at night, early in the morning. Only at daytime, mainly in the evening. All osteoarthritis, spondylosis. So like that here also. Symptoms at night, mainly at night, more at night, more early morning, and these symptoms will increase if you are exposed to an allergen. I mean, somebody is smoking in front of him, and that smoke, which maybe I will tolerate, he will start coughing. So he will think that he is coughing because of him, his smoke. You know, like this. He is allergic to that smoke. or he's some girl, Farida, these modern women are very known perfume. The amount of perfume they put, So but suppose this man is exposed to perfume, he might start coughing. So in the kitchen, strong smell of the masala comes. He's passing from there, start coughing. Allergen, pest control is done in the house. Finish. He start coughing. He had ice cream somewhere, cold drinks, he start coughing. These are precipitating factors. And this patient then, as I said, the important thing is that history, if you can get, which you people don't spend time on, that do you get up at night? Do you get up at night because of your symptoms? A young man like him, he works hard like hell, he goes for his business, whole day is working. He should have a strong sleep. Of course, after going to his wife and all, that also, that is it. That is exercise. And sexercise. That's not exercise, sexercise. So sexercise ke baad and then you are so tired. You should be sleeping, that nobody should be able to wake you up. That much good sleep you should get. But if you tell me that you have to get up at night once or twice because of a little cough, difficulty in breathing, grossly abnormal. Grossly abnormal. So this gentleman had to get up once or twice in the sleep. And for the last 20, you will not believe it, 20 years, he was taking Estelin inhaler. He would get up at night, take a puff of Estelin inhaler. Sometimes, second time at night, take Estelin inhaler. This is how he has lived. This is how he has lived. For 20 years. Till last week, 2 weeks back, his father said, chalo kisi ko dikha do. Chalo OP Kapoor ko dikha do. This is how he ended up with me, with this company. So I heard the whole story. There was nothing straightforward, asthma is there. But taking Estelin inhaler regularly, in UK, all the deaths which are occurring are because of that. There they have Ventolin. All the asthmatics who have been taking only Ventolin during their lifetime, or every attack, every day like this, at night, they suddenly get ventricular arrhythmias. Ventricular arrhythmias, and they die. And young people dying. So 100 deaths in UK per year of 100 people, yes, not acceptable. And they found out that all these fellows, the doctors, were not giving them steroid inhalers. They were giving this. When you get an attack, you take this. When you get an attack, you take it. He was following the same principle. When he gets the attack, he takes it. So he gets the attack once or twice at night. So every night he takes. Every night he takes. He's been taking it like that for 20 years. So when he came, I explained to him. I said, see, I examined him and I found him little underweight. I said, I can make you put on some weight. बढ़ रहा है ना
अभी 10 दिन में थोड़ी बढ़ेगा
10 दिन में लेकिन बढ़ रहा है ना बढ़ रहा है और शक्ल से भी जरा he is looking 1 kilo उस दिन that day came he had increased 1 kilo or 1 kilo 2 kilo 2 kilo he has put on in 10-12 days. I'll make him put on 10 kilos, no problem. See, these people are giant people. Very easy to make them put on weight because all these communities there, they have been told by their leaders, by their so and so, that don't eat this, don't eat egg, don't eat chicken, don't eat meat, don't eat pork, don't eat fish. But eat what? That nobody has told them. That is it. I have been telling him, you adopt me in your community, make me meet your leaders and all that. I will also, along with them, give a little bit of a bhashan and a lecture and all that. And I will tell you what to eat. For example, if these people are not getting any proteins from all this food, that second patient, she's not coming, is it? She's not coming. Pinky Jain. Pinky Jain was another patient who was supposed to come today. And that lady, a beautiful case, where
contrast to him, where she had asthma also, bad asthma. But on examination, she had pigmentation of the knuckles, both sides. And she was also worried. She said, I want to know why I am getting that. Even the creases were slightly darker. So moment I saw that, I told her, I said, this is Jain community, trademark. In the sense that they have this B12 deficiency, very common, because they don't have non-veg food. So B12 deficiency will cause this pigmentation. And her B12 level was very low, less than 100. So we are giving her a lot of vitamin B12. So I wanted you to see, but then I knew they may not come because, just to show that. But she had also another important thing which I wanted you to see. That I wanted you to see my letter which I have written in the file, which I write, even he forgot to bring his file. Where I write down. So this is the illness, this is the illness, this is what you should do, what you should not do, what you should eat, what you should not eat, what medicine. There, in the prescription was written down that steroids, she was big, 60 kilo, so 60 milligram for 5 days. I did not. So 5 days or 1 week, I don't remember, one of the two. And then inhalers. So what happened was, this lady continued to take that steroid, 60 milligram, for 6 weeks. No, for me there is nothing. I see so many of these patients, we give them for 6 weeks, 8 weeks. No? Nephrotic syndrome, what is the treatment? 1 milligram per kilogram, 8 weeks. So I would love to see a nephrotic syndrome patient who is come for edema and all that, and if a biopsy shows fairly good, then not a very bad vasculitis, etc., then I'll put them on 1 milligram per kilogram, and I tell them that in 1 milligram per kilogram, 60 milligram, in 2 months you will become like this, swollen up, 10, 20 kilo weight, face big. We warn them already and tell them, and when I stop the steroid, the whole thing will go down. This is what happened in her case, that she took 60 milligram for 6 weeks and became 10 kilo more, 8 kilo more. Basically like that. And husband knew something is going, but she was alright, no asthma, nothing. He knew something is wrong. And when he came, then my secretary also drew the attention, what is it? You were renowned 1 week, and you were given that for 6 weeks, 60 milligram. That's okay. In this patient, I explained, we have no cure for asthma. Passage of time, development of immunity. So many of them, they go to Rajasthan, they're all right. They know asthma. तुमको राजस्थान में
कम नहीं होता है.
नहीं, बहुत लोगों को कमती होता है. हाँ, बहुत लोगों को कमती होता है. Then unless you settle down there permanently, then you can be cured. But they don't want to settle permanently. Business is in Bombay. So which means there is nothing like a cure. We are looking for time when there will be remission. Remission means disease goes to sleep. Disease goes to sleep. Yesterday, that young man had come like him, with his father, very first patient. I'm forgetting, he had a similar illness. And as soon as I asked the father said he had same thing which lasted for 10 years, 10 to 12 years. His father was 55, 60 years old. I was very comfortable. I was telling his son, uska bhi 10-12 saal chala, tumhara bhi 10-12 saal chalega. Finished. In the sense that we have no cure. But we can suppress the symptoms with our steroids. But the steroids have got side effects when you give them like this lady took 60 milligram for 6 weeks. So steroids have to be given by inhaler, where there is a minimal dose. The inhalers are made by biomedical engineers, not doctors. Doctors have got no brain. All doctors have got no brain. No brain, no common sense. Doctors are exactly like motor mechanics. Exactly like motor mechanics. See, some motor mechanics are very clever. They'll make a diagnosis like this.
and only change that part, finish, your car is working. The others who like to go on experimenting, ये भी हो सकता है, वो भी हो सकता है, पहला वो part बदली करेंगे, फिर देखेंगे, फिर आना, like that they'll talk. But these biomedical engineers have got brain, so they produce something which we could give by inhaling the steroid, which directly goes in the lung. Nowhere, no heart, brain. Our drugs, so salbutamol, you are giving by mouth, it goes to the heart, then you get you get palpitation. It goes to the brain, then tremors you get whole day. Side effect, side effect. So if they produce these inhalers which produce microscopic doses, no side effects. And after every dose वो जो लेते हो उसके बाद कुल्ला करते हो. कुल्ला को भी इंग्लिश में क्या बोलते हैं? गागल्स. अच्छा, उसके बाद करके गागल, उसके बाद वो नहीं करते तुम? करते हैं ना. What do you rinsing? In English we call rinsing. घुमाओ. Idea is to remove the food particles and also here also steroid also to do same thing. So if you do this, they think when you take that, you can take it for 10 years, no side effect. I'm talking about adults, not small children, infants. I'm not talking. And you will not get asthmatic attack, but 1 to 2 twice in a year you will get it. Suppose pest control. His whole shop is put it in a pest control. And the way when he enters that day, little wheezing will start. Then he uses Estelane for that wheezing. So, and the second commonest, I'm telling you the commonest reason why they get the attack every year once is common cold. Common cold, see, because common cold virus spreads so fast, you know. So when in the family somebody has got virus cold, if he gets a little cold, he'll get an attack. Then he'll get an attack. So when you get an attack, then you can use SL inhaler. But suppose more attack, 3-4 days he can't sleep at night, then he will need that not steroid inhaler but steroid tablets. Steroid tablets. He took those tablets in the day. How many? कितने दिन के लिए वो गोली खाई?
7 दिन का.
7 days. 7 days. 40 milligram. 40 or 60? भूल गया मैं. Some 40 or 60 I gave him.
2 दी थी every day.
No, 220. That means 40. Give him 40 milligram for 7 days. That is to control the asthma. See, that is control. This is poo-poo is maintenance. Simple it is. If you can only understand this. After all these lectures I take, after all these I find still doctors are making same mistakes. And therefore the patients also making same mistake. When you get an attack, this is not the treatment. Tablets. And 1 milligram per kilogram, if possible. Little less, 40 milligram you can give. Not more than 1 week. 5 days, 6 days, 7, depending on what. That is the treatment. Now, you have to maintain because you're not cured. You suppressed it. Now, to maintain, he needs that maintenance 500 microgram. वो 500 का ले रहे हो, 500 का ले रहे हो, so वो 500. That he has to take. That he has to take in the beginning twice a day. You can give 3 times a day also. You can give twice a day. Then later on, maybe once a day. How long? I don't know. I don't know. I can give him for 2 years, 3 years. What is the problem? What is the problem? And then he used some bad word, which I think I'm mixing up with the fellow who used yesterday also, that boy. Used the same bad word. That rose every day? Itne sir? Then I got angry. I said, अभी तो मेरा
ब्लड प्रेशर बढ़ गया, अभी तुमने हमको गुस्सा दिला दिया, क्या हुआ? ये बीमारी नहीं है, दिस इज एलर्जी. दिस इज बिकॉज यू आर स्टेइंग इन बॉम्बे, यू शिफ्ट समवेयर, you go to Canada, go to Australia, there will be no asthma, nothing. You won't need any inhaler, nothing. Then this is a handicap. वो क्या होता है? वो क्या होता है? अभी हिंदी में बोलना पड़ेगा कि तुमको हैंडीकैप है, बीमारी नहीं है. अभी इनको बोलो हैंडीकैप, हिंदी में क्या बोलोगे? नहीं, they can't find words. अपाचित, they like lulla langda and all, leprosy patient, these fingers are fallen down, nose broken, they call them, that word they use. That means even this new illness which has come in the market called allergy, this, I get this in the nose, he gets in the, there is no Hindi proper word in Hindi and Urdu to explain to them what it is. This is a handicap, not an illness. So then he still could not understand and I could not make him understand, so then I made it very short. देखो, ऐसे तुम बोला रोज 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 तुम ऐसे मतलब you fed up of my talking रहते, I'll change. हैंडीकैप है ना, मैं टेलीफोन करता हूँ, फरीदा मोबाइल किधर? ऊपर, ऊपर मेरे पास नंबर है ना, ऊपर है क्या? मैं उसको टेलीफोन करता हूँ कि देखो इसको ये अनकिट है ना, अनकिट है ना, वो बोलते हैं उसको एलर्जी नहीं चाहिए, हैंडीकैप, उसको बदली कर दो, बदली कर दो, नहीं निकाल दो, नहीं निकलेगा, नहीं, अच्छा बदली कर दो, हाँ होएगा होएगा होएगा. क्या बदली कर? उसको हम एक चश्मा देगा, जाड़ा चश्मा लगाने को. वेरी गुड वेरी गुड, हाँ हो गया. ऊपर हम बोल दिया एलर्जी खत्म, ये फूफू लेने की जरूरत नहीं, लेकिन वो बोला ऐसा चश्मा जाड़ा पहनना पड़ेगा. कितना दिन? सारी उम्र, जब तक तुम मरेगा, सारी उम्र हम ऐसे चश्मा पहनेगा. नहीं ये अच्छा है, रहने दो, हम चलेगा. फिनिश. पेशेंट इज कन्विंस्ड that every handicap has got its own type of management. God has given you a good handicap, not a bad handicap. Handicap where you can take this with no side effects, you can afford to take, and which may last for few years, may not be lifetime always, 5, 10 years, 15 years, disappear. Give him a big hand for coming here. Thank you. Thank you.
Now, as compared to this asthma, I am going to now show you the next case of again asthma. But look at the asthma, different type of asthma. Can I have the next patient, please?
He only exercise. Julelal, Julelal. Anyone? Huh? No, not I know the whole thing. Acho, 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 acho. इधर दिखाओ, ये हीरो का फोटो हमको इधर दिखाओ. कमलेश, हम देखते हैं ये ताजी उम्र घड़ी 77 years old and look, अरे हम तो निकल, उसको देख, अच्छी तरह दिखाओ ना, उसका फेस दिखाओ एकदम हीरो. ये देखो, ये देखो, एक बाल सफेद नहीं है मेरे के जैसा, एक बाल भी, सब काला बाल. देखो मुझे भी देखो, ये देखो 77. Acha, now he had smoked 9 lakhs cigarettes in his young days. Okay, so he naturally developed COPD. Raj Kapoor also developed COPD, died at 60. Raj Kapoor's time there was no pulse oximeter in Delhi. Can you believe it? There was no nebulizer. And here, this man's, you know what? Oxygen tank what on the rose?
About 8 or 10 hours.
10 hours oxygen he takes every day. He is leading a very active life. Don't underestimate him. Huh? He wanted to go to Pune today. I said, no, you come for my lecture. He is doing business. He is doing everything. He came to me last 2 years back with 92% oxygen and on 6-minute walk test, 88 SpO2. 88. Once you are 88, we start oxygen. See, because I started oxygen, इधर दिशा शर्ट लाए, एक मिनट है ना, शर्म छाए, लाए ना,
You look at his muscles and all that. His solid muscles he has got. And how much does he walk?
4 hours.
4 hours per day. How many kilo?
Morning 3 hours, and evening 1 hour.
4 hours walking, normal people cannot do. This man's oxygen is around 96, 94, 96. It never became normal. But I want to show you now a new image of COPD. Raj Kapoor died with those days, nothing was available. And plus we didn't have the concept of COPD. That wife will say, chalo mat, saans chadte. Now it is opposite. We have got rehabilitation centers for COPD. They make them walk every day 5 kilo, 6 kilo. These people are ready to take oxygen. Look at his muscles. Look at his weight. Solid like a hero. Those people lose because they have no oxygen in the body. They don't take oxygen, so the muscles got waste. Appetite goes down. They lose weight. Their life becomes miserable. Just because, oh, there was COPD. Lungs are weak. Don't strain the lungs. Wrong. It should be opposite. Rehabilitate them. Teach him. He takes oxygen. He takes nebulizers every day. Oh, just now he was going to Pune. He would have taken his nebulizer machine also with him. He takes the inhalers. We give them steroids. Many of these patients, including not by mouth, not the steroids like ILD, which cause side effects. These inhalers cause hardly any side effects. So he takes nebulizer. He takes oxygen. He walks 5-6 kilo, and he is a hero. Look at him, 77. He will compete anybody, but like a hero, he looks hardly 60.
You must say 77. Young no.
77 young.
Yes.
Give him a big hand. Give him a big hand. Thank you for coming. Thank you. You have seen these two patients of asthma. The first patient, bronchial asthma, there is no treatment, nothing. The GP doctor has to talk like a psychiatrist. Assure him that it is a handicap, he has to live with it, and SOS take those inhalers. He live a normal life. Well, COPD is a very bad disease. He developed it after smoking 9 lakh cigarettes. 9 lakh cigarettes. So the lung is finished. In fact, if you want to have your patient permanently with you, it's always better to get a CT scan. Of course, chest X-ray though is must. For all COPD, every time he comes for a visit, chest X-ray has to be done. They're very liable to develop pneumonias. Remember that. But you want to do CT scan to see if has he got some balloons inside, amphibious balloons which are not functioning at all. If he has developed that, then his prognosis is bad. Then all this will not work, which you saw. But if he hasn't got, that man, you can give him a normal life, but he has to become like a mini doctor. See, this man has learned so much in his house. It's like a dispensary there. He's got pulse oximeter. He goes on seeing his oxygen 3-4 times. So he can takes oxygen 10-12 hours per day. Nebulizers 2-3 times a day. In the nebulizer, you can put steroid, you can put bronchodilators, you can, depending on the antibiotics. So you can give all that and make him walk. He can lead a normal life, provided he has taken pneumonia vaccines, 2 yearly vaccine influenza, and provided he has a regular checkup done. But I want to only warn you, he is 77. He smoked 9 lakh cigarettes. Actually, he should have died at the age of 60 after smoking 3 lakh cigarettes, which most people are doing. He didn't die. So, his heart is okay. But are you sure that this heart will remain okay? So, when these people develop increase in symptoms, which means dyspnea, remember that there is one, you have to remember this anti-pro-BNP. Anti-pro-BNP is a blood test where if that asthma this time is due to heart and not lung, this will be very high. the blood test. So these people can lead a good life, but very costly. Everything is very, very costly. And at the same time, their prognosis is they could be having associated what problem? Many of them have associated diabetes, hypertension. So COPD is an illness. Old people get, ex-smokers. Bronchial asthma is a handicap. It's not an illness. Thank you.